That our next introduction is going to be the moderator for our panel today, Mr. Supreet Singh. He's the director of Psychocare Health Private Limited. He's a celebrated and award-winning entrepreneur with a bachelor's in electronics and communication engineering and diploma in broadcasting and performing arts from Columbia Academy, Vancouver. So he's obviously multifaceted. And the Psychocare Health Private Limited is a testimony to his vision and his leadership and has been in existence since 2013. And he's, like Mr. Nair said, doing multiple other things. But really over to you, sir, to moderate this session with our speakers and panelists.
Sure, thank you. Good evening to everyone. And it's an honor being here and moderating such eminent personalities and being among such great personalities over here. The aura is amazing over here. So for me, I feel that the journey for me in healthcare has just begun, but there's a long way to go. Over the years, I just, before starting, I just want to give a brief about how my journey in healthcare started. So I was living in Canada, loving my broadcasting thing. One sudden day, I interviewed a business analyst and he told me that, what are you doing here if you think of going into healthcare? This is the time to be in India. And it was 2012. Today, it's a testimony and I see that. And the way India has grown and the way India is going to grow in the global healthcare platform is going to be humongous. And I think we all are here and celebrating this book. It's a testimony to that. So thank you for listening to my words. What I personally feel over the years, what has happened is we have been very casual about health. I'm audible to you, sir and ma'am?
Yes, absolutely.
Yes,
Very clear.
yes, you are very clear.
So what I'm going to keep my questions candid. I host a podcast and that's candid, so I'm used to being candid. So what I've realized over the years that we have never been very concerned about our health, preventive health. So it's always been कुछ होने के बाद ही हम कुछ करते हैं. So it's been always like that. Since COVID has happened, now we are getting concerned about health, preventive health. So I want your take. Have we really learned from the COVID, or still we are living in the dark? So maybe, probably.
Well, it's very difficult not to learn from COVID, because I do believe all of us were struck by the impact of COVID. And I think you're quite right, Supreet. You put your finger on the most important thing, which is essentially that India has 1.4 billion healthcare providers. If you talk, for example, of a family, you talk, for example, of a sister or a mother or a daughter, and the way she looks after her family, the way she ensures nutrition, the way she ensures a better life. I think that is a very big step towards what was very correctly being said by the distinguished doctor here. And we have some common friends. I'm not going to talk about that now, but some other people who respect thank you very much. But all I can say is, Supreet, it's very important to make healthcare part of primary education, part of the socialization, part of the way parents educate their children, children educate their friends. It's very important to understand that healthcare is not just for the expert. Again, apologies to the expert here and to two experts here. Joe is also an expert. It's for all of us. And we're all, in a sense, part of the healthcare system. And I think that is what COVID taught us, that any single link in that chain, and it's a huge link of hundreds of millions of links in terms of people, any small link can basically, destroy a huge swath of social stability. So I think that is very important. The second is those who have got a feeling that, the so-called the global south, well, it's where it is. It can't be more than what it is. It's not really capable of doing very well. Well, I'd like to say that the doctors from India who have gone to the United States lifted the reputations of all of us. I remember a time when immigration officers in the United States, customs and whatever, would look a bit down at me because I am Indian. But lo and behold, when a huge number of Indian doctors landed there, that changed to great respect, tremendous respect. And I think, the fastest, our people have shown you can use tech in more than 1 billion people. They pick it up very quickly. And the important, therefore, is to provide them with the tech. For example, some of us have talked about a laptop with every school, with every student. Because I've seen for myself, for example, schools in the most disadvantaged areas of the country, you give them a laptop, you give them access to the internet, and in a matter of weeks, they pick up what students who have got much better advantages economically cannot pick up in months. And some of them cannot pick up in years. So I think, Supreet, the point is, first, fast tracking of health. The entire population of the planet, all 8 billion of us plus, can do it if we try and if we believe we can do it. And secondly, we're all healthcare providers. And I think that's also the lesson which our distinguished doctor colleague told us about, this question of investigation coming into the picture. And I must confess that all of us have been guilty about getting a battery of tests done and then going to a specialized person. I must say, the next time I do that, I'll know I'm doing something wrong. Thank you.
Thank you. Thank you so much, sir. I would like to know about your opinion, Dr. Ruby. What I've realized, like over the years, I just want to add one point, what sir has mentioned. There's a term called as holistic health, which has recently come up like really fast. But people are, what I personally feel is people are not able to understand what holistic health is. If you can put some light on that and your opinion on preventive health as well. Thank you.
Thank you very much. In fact, this is exactly what I was trying to briefly say in the limited time that I had in my introduction. So I was rushing up with things and I couldn't really elaborate on it. And what I try to say is that holistic health is a component of the human, animal, and environment. It's all put together. We live in one harmony, and it's very important that the human health can never exist in isolation. And the COVID-19 or zoonotic diseases like that are a huge example of why they happen, because we are causing a dysbiosis, a disharmony in our very existence with the environment. And that's why the planetary health is very important for human health when we talk about preventive medicine or preventative strategies. So preventative strategies is not only about making the people aware of the diseases or going just to a private, a general practitioner, but it's way before that. Things start in the mother's womb, what we know as the microbiome, which is present in the gut and which is important for immune health, which keeps our body healthy, this basic immune health. That happens even in the mother's womb. So the maternal nutrition, the environment the mother is exposed to, the children early years of life, the food they eat, the environment, the soil, water, air pollution, everything together, composite, makes a big difference. The loss of biodiversity that we see, that also has a huge impact. Mental health is completely ignored. And mental health, you see forest fires, you see the rise in temperatures that are happening everywhere. All these things affect. So our health cannot be prevented by just giving a recipe and saying, okay, this is how you prevent health. It has to have all these composites together to be able to achieve that kind of, and in holistic health, I would also like to say our traditional medicine like Ayurveda is also something that we should take into consideration. And then we have, of course, the fact that we have to get this, as already mentioned by Professor Nalapat, that we have to bring it to the 1 point for everyone is a healthcare provider, because the mother is the first healthcare provider. She's the one who educates the child. She's the one who see. So right at that grassroots levels, things have to change. Even when we talk about climate mitigation, even when we talk about planetary health, governments can make policy. The G20 can make a recommendation. The P20 can try to implement it. In Singapore, they have legislations that you're fined if you do something against but that is not enough until civil society takes responsibility, understands it. So awareness is very important at grassroots level. Digitalization to make people, just as was mentioned about computers and everything being available. So digitalization should be everything is accessible. Harmonization is very important, because when we talk globally, we have different standards. DC in India, FDA is different, EMA is different, PMDA in Japan is different. We need a harmonization of that. So there are multiple levels of this, and we need to put those all different blocks together to be able to achieve that. And it's not something we can achieve overnight or in a few months, but I think with India's leadership and with its power of the healthcare providers, its power of technology, its power of digitalization, its power of telemedicine, of AI, all put together, India can lead. As is mentioned in the book, India can lead. And that's what I think we should do.
Thank you so much. And that's provocative. I feel similar ways that if technology is embedded with the awareness, the people need to be aware, and it has to start from the civil lives, that from the womb it starts itself. Thank you so much, Dr. Ruby. And I have a small question, Ambassador, that I personally feel that food should be a part of healthcare. And we talk about the food the least. It's more about the taste than healthcare. Like, for example, milk were an integral part of Indian healthcare system, and we were all healthy, I think, in a way. So how can food be a preventive part of health, and how can we change the dynamics, the paradigm?
Thank you very much, Supreetji. It's indeed such a great pleasure for me to be participating in the session, even though it's only virtually. I wish I'd been able to come there in person and interact with all of you and meet up with a lot of my friends who are there today. But I look forward to doing that in the near future. Now, also, before I talk about food being an essential part of well-being and wellness and physical health and mental health, what I'd like to say that it has been such a great pleasure for me to listen to some of the distinguished panelists and speakers, including General Sharma, who spoke from his heart, my dear friend Amitabh Kant, whom I've known for a very long time, who agreed to write the preface and to participate in this event today. Minister Hardeep Singh Puri, who's been my mentor and guide and friend since the day I joined the service, and whom I have a lot of respect for. And of course, Professor Ruby Pavankar, whom I look forward to meeting someday, Professor Madhav Das Nalapat, who's one of the most distinguished people we have in India in terms of thought leadership. So, and amongst many of the others also there. But what I would like to say about food is that, food is definitely a very important part of the framework and construct of every individual being. Now, we have been told by our ancestors, by our parents, by the gurus, that sattvic living, sattvic food for a sattvic life. There are different types of food: sattvic food, rajasic food, and mansic food. And I do not want to get into the details of that because I do not want to offend my friends who go beyond the vegetarian, diet. But sattvic food basically consists of the plant-based diet. And a friend of ours, we live in Washington, D.C. currently. She recently wrote a very eminent book, which is called Healthy Food for Happy Living, for a Happy Life. Now, she talks about Ayurvedic cooking, Ayurvedic food, how the Ayurvedic path, Ayurveda has shown the paths to healthy living in terms of having a healthy physical existence, having a healthy mental existence, and being able to surmount diseases and challenges to mental and physical health. So the world has to also sort of start appreciating this a little more and come back to the basic grassroots. The pandemic has, of course, impacted our lives in very profound ways. I was impacted very personally because some of our closest friends, were sacrificed to the pandemic. And that got us thinking as to how we can work together. And I thank my dear friend, Dr. Joseph Chalil, for working together with me on the first book, which actually became an Amazon bestseller in two categories, healthcare and public policy. And also became one of the 20 best reads in the world on the pandemic recently. And also this second book which has come out on this area, this is my 8th book in person, but the second book on the pandemic, which has also become a Amazon bestseller in 3 categories during the pre-launch period itself, with over 1 lakh tweets, and it has a long way to go. Now, what this has taught us is that therapeutic care is also required, but what is much more required is basic well-being and wellness. And how do we focus on that? Through meditation, through yoga, through diet, through exercise. So diet becomes a very important part of daily living. I personally am a vegetarian. I've been a vegetarian all my life, since my birth actually, and that has stood me in very good stead. Even at my age, with the amount of you know, kriya and yoga that I do not feel one bit my age. I feel a lot younger, and I feel I can continue to contribute a lot more significantly to society, to community, and to the world. Now, from that perspective, to have a little more emphasis on the diet, I think you have made a very good point, Supreet. We should have given it a little more prominence in the book, and we will keep that in mind in the future, because we do look forward to having a lot more discussions about the pandemic, about the book, about the contents, about the future, and about having more interactions about the contents of the book also when I am next in India with various groups. So the other part which I would like to mention here, Supreet, is that it has been an inflection point in many ways at different levels. When I look at it from a perspective here, sitting in Washington, D.C., and looking at the world, looking at India, looking at the other countries, what do I see? That this was a transformational journey for India also, internally and globally. It has emerged on the global stage as a real Vishwa Guru, as a guru in the truest sense of the term. Because in the West, what I saw was a very transactional approach, a very commercial attitude and outlook. Even for selling vaccines to other countries, they wanted their price. Even the way they were bargaining with India initially, before India embarked on its own path to discover a new way of doing things for the world and for itself. And the vaccine war, that way, is a very outstanding movie, and I would recommend it very highly. But I would also say that certain countries like China had a very dubious role to play in this entire scenario, whereas India emerged as a country which not only did a lot of good to its own citizens, but did a lot of good to the poor and developing or least developed countries of the world, by providing vaccines free to them, by looking after their healthcare needs. And we have been doing that in medicines and pharma, as you know very well, compared to all of us, because you have been in this field now for such a long time. So I do look forward to the scenario where India continues on this path and becomes the leading healthcare provider. India is the largest population, 1.4 billion people, number one country in the world, more population than the entire Western world put together, or the entire continent of Africa put together, or the Americas put together. And our rural population itself is about 900 million people, 897 million people. Now, that population again is more than the continents put together, whether it's Africa, or Europe, or Americas. So, if we have to cater only for the rural population of India, which I want to emphasize is another very important segment which we are working very closely with in India, with the governments of Madhya Pradesh and Himachal Pradesh, and also with Gujarat. So, those sort of initiatives are very, very essential in healthcare. How do we recast the ground level scene in terms of not getting into the transactional and commercial approach, like Professor Nala has also mentioned that one of the delivery systems which is very wanting is the system in America in terms of the costs and benefits associated with it. And how do we now leverage the advances in technology in Industry 5.0, Industry 4.0, and make it more human centric and for the benefit of everybody by using AR, VR, MR, the different sorts of realities, machine learning, data analytics, cloud, quantum computing. How do we leverage those advances in technology to make healthcare, well-being, wellness, and thereafter treatment accessible to all at a very low cost, which is affordable for all? Thank you. Back to you, Supreet.
Thank you. Thank you so much, sir, for your insights.
If I get
You've kind of summed up a lot of things with the vegetarian diet. Even I'm struggling right now. I try, but still a battle I'm trying to win. Uh, if we talk about uh, General Sharma, sir, I I'm so much intrigued by the workings of the defense forces. I've cleared SSB once. I couldn't join for some reasons, but I'm so passionate about the defense forces and how they operate. So, as you mentioned that you have primary, secondary, tertiary, and then the stepwise, and there's a medical inspection room, which is actually not a reality in the normal lives or in the normal world outside of the defense forces. The idea is great if it can be inculcated in the mainstream, but what's the any roadmap you can share? Like what's in your mind, how it can be done?
No, what it probably requires is a tremendous amount of discipline. Now, an armed forces officer, once he joins, the young medical officer, he's posted to the absolutely the periphery, the Bonduks, where there are times when he doesn't even have people to socially interact with. He may be all by himself, some border areas. Try and post an MBBS doctor from a civil medical college to his own state's rural health service. He pays out, he bribes, he does all kinds of things. He pays the bond money but does not go to that primary health center.
Very true.
It's a bit of a shock. Here we don't have a choice. If you join the armed forces, you're ordered to go somewhere, you go there. Right. So basically, essentially, it requires that kind of a discipline. After more than 75 years of our independence, the government of India has not been able to ensure adequate health coverage for its rural population in terms of primary health care. So there are primary health centers, but without doctors, without paramedicals, without staff. They all want to stay in the cities. So it requires an attitudinal sea change actually in India, but it can be done. The pandemic showed us, because when it became an emergency, everybody pitched in. Everybody pitched in. It doesn't happen during normal course of events. So we need to attitudinally change ourselves. That's what I mean. And it's a big ask. It'll take probably decades, not years, decades. But it can be done, you just need the resolve. You just need to find ways. That's it.
So one more thing I would want your opinion on that. There's a sometimes, like, we are in a city right now. When we go 50 kilometers to a village, there's a huge difference in the 50 meters itself. Uh, and most of the people, again, as you mentioned, come to the. Can telemedicine somehow help in that way?
Oh, the book has very beautifully covered this topic. And the world over, the modern trend is into telemedicine. In fact, because Mr. Amitabh Kant told you, leveraging technology to provide adequate health care, telemedicine would be a huge, huge boon. It just has to be effectively put in place. That's all. And it is being done in India now. I myself, on a given day, attend to some 15 odd telemedicine calls. Of course, in my specialty, people consult me only for nephrological problems, because it's not always easy to land up with a nephrologist. But the fact is, telemedicine will help. You would believe me that uh, an ECG recorded in a peripheral rural primary health center can be transmitted through telemedicine to the top cardiologist, who can give you the diagnosis, who can suggest, please evacuate him to the city of Bangalore because we need to change his heart valve. So that is the great boon that telemedicine can bring in. Yeah.
Thank you so much. Thanks for that. Dr. Charil, over to you.
So you can invest in telemedicine.
So we already we have already associated with one the same. They're doing great work in rural India.
Yeah, I mean,
You
if
wanted to say something, ma'am? Yes, please.
no, I was just saying that, telemedicine is now being done, I mean, in many places in India, of course, as Mr. Kant mentioned, but I said telemedicine as well. AI. AI is very important. I think AI now is being adopted in many places, even for radiological diagnosis, but of course, we need to have multiple layers for it. We need to have policies to ensure the security of it, the correctness of it. All those things need to be put in place. But I think AI and digitalization, which is also put as part of the G20 recommendations of India. So I think if we move forward in that direction and getting it to right to the grassroots level in the villages, I think that is very important. And addressing that, just wanted to make a statement about what Ambassador just mentioned about affordability. And I think that financial sustainability is most important. Whenever we bring these kind of new technologies and new things, being able for India to lead globally, it should be made financially sustainable to the providers as well as to the patients. I think that's another thing we need to really work on, and that requires public-private partnerships and international collaborations of the government and other institutions like IIT or other medical institutions like AFMC and so on, with international institutions and organizations to make this happen. But that's a very strong possibility. And it's happening in many ways, like nanotechnology and all is with IIT and institutions in Japan. It's happening quite often.
As it's well mentioned in the book, it should be a sustainable model. And first of all, congratulations for being Amazon bestseller already on day one. It's a great achievement. And Dr. Chalil, we have discussed about preventive health many times and how India is leading in terms of healthcare, in terms of multiple things, even pharmaceuticals in multiple facets. How do you see India as the epicenter for healthcare in the next 10 years from a global perspective?
Well, first of all, thank you so much for everyone for coming in and making this a very good success. As Supreet just mentioned, this book went on sale globally today, already became a bestseller in 3 categories. In fact, the number 1 and number 2 in some categories are the books paperback versus the hardback. So thank you, KPR and his team. So I don't think it has happened ever that the same book in 3 versions have become 1, 2, and 3. It's competing with its own. So, hey, but it's a loaded question what you mentioned. So, there's 2 aspects of it. Number 1 is what we see India as in the future, in the next 2 decades. A lot of crazy ideas. Some of them are mentioned in the book. There are some which are not mentioned in the book. Maybe I would rather mention which are not in the book, because the book, what you can already read, you don't need to repeat what's already in the book. One thing which we want to talk about is that, again, the whole purpose is that, as General Sharma mentioned, as Dr. Pavankar mentioned, is that we need to move away from this. We call it healthcare. Everybody claim healthcare. Are we really caring about people's health? As a doctor, am I really worried about, is my patient working out or stop smoking or not drinking or eating right or exercising, versus am I just fixing a disease? So I would rather call it a disease care system, where you come in with a sickness, I fix you, I send you back, I cure your disease, and then you come back again with another disease, I charge you money more, or I put a stent in you, or I treat your diabetes, but we're not really caring about healthcare. So I think it's a good marketing that we call it healthcare. We're not really doing it, So it is not an India problem. The same thing happens in USA, where it's a much more larger, costly affair. We fix diseases, we send you back, you come back. They have made some rules that you can't come back in 30 days. So they'll make sure that you stay at home for 30 days. But then the 31st day, you come back with the same disease. We'll admit you back again, and we'll bill you for the same thing. We'll in the differences, we'll bill the insurance company, and then we'll send you back. So this like a catch where everybody's minting money. A patient is not better off.
Yeah, in India they call it hafta.
It's again, I don't want to call any bad names and get in trouble with it.
It's not a bad name.
No, actually, that is Indian or hafta means really weekly.
Okay.
Nothing bad.
So if we can move away from our disease care system and get into a true healthcare system, we can design it. Great. So coming back to the India's role, another challenge which we don't talk about in the book enough is that there is a global human resource shortage in healthcare coming up in the next decade. So America will be short of over 100,000 doctors. UK, Germany, France, Europe, Australia will be short of physicians, nurses, health middle providers. The challenge will not just be that their population is aging, and their doctors are retiring. So there's 2, I would say, well-planned events, which is predictably happening very soon in the next 5-6 years or so, where I would say India might be the only country which can solve. And that's where technology comes in. I see a way where we did telemedicine or back-end office help desk, 1-800 numbers when people are calling help desk in Dell or Comcast or whatever it might be. The calls were routed to India, 10, 20 years ago. Of course, now it's routed to other countries because India has become more expensive. But I see the same way India will become the telemedicine or primary care hub of the world. So I wouldn't be surprised if you would see a call center of, let's say, 500 to 1,000 doctors sitting in a hall in Bangalore, with cameras, with screens, which have IoTs, internet operated devices. Like, for example, my watch can now take ECGs. It can measure my blood oxygen level. It can measure my temperature. So these can be transferred, as General mentioned, to any doctor anywhere in the world easily, and I can be monitored remotely. The blood sugar can be monitored remotely. Your blood pressure can easily be monitored remotely. So it is going to happen that the triaging, the selecting of the patients early on, like who needs to be seen to a specialist who need to be seen, by a specialty clinics or transported to a hospital might be done by Indian doctors sitting in. All we need to do is to, work with the training of the doctors, make sure they are trained internationally, make sure they are trained in languages, which is, English, German, France, whichever might be with French. So this is going to happen. I'm not sure any other country can handle this volume of healthcare. So that's one thing which is, and then the second thing is how AI, when we're talking about not just language learning modules, we're talking about language action models, which could then automatically detect these are the patients who require consultations, and then deciding on which treatments need to be done, which doctor need to be referred to. So without even any human doctor interface. So this is going to happen in the next 5-6 years. And the challenge is, are we ready for it? Is the system in India ready for it? Are our education systems ready for it? Now, how do we combine our medical schools with our IITs, with our IIMs, making sure our doctors are not just medically taught, but they're technologically savvy. They know how to manage a system. They know how to speak languages. So we have to make them better doctors going forward. I would even say, like we always had dual education system in the country, like the state syllabus and the CBSE or ICSE. We might even need to start, training international doctors in these countries, in our own medical schools. Maybe train them in MD programs like in the US or in Europe. So I'm a very bullish person on India leading the world in healthcare. There is no other option. There is no other country available. So we would be dependent, and the world will be dependent on India. So it's up to India to provide the services with technology, with AI, with our human resource capital, the smartest people in the world we have here. We need to use them. And I'm pretty sure, sitting in America, I can clearly see that our system is declining. I don't see the next decades belong to America. I would say the next decades belong to India.
Wow.
Dr. Pawar,
Yes, sorry.
So I just want to add to what Dr. Chalil was saying.
Yes.
Now take, for example, Japan. It's an aging society. They need carers. You have in Europe, many countries, and they're not finding them. And you need doctors, and you're not finding them. Now, the point is, yes, we have the potential, the human potential. And I mean, I personally, Dr. Chalil, Ambassador, we've all seen that personally when we visit these places, how quickly people learn. But the point is, it requires, like, for example, a jewel. It looks like a stone, quite ordinary. And then you process, and it becomes a jewel, the very precious jewel. So we have hundreds of millions of very precious jewels. And the question is ensuring through the education system, through the nurture system, through the various other value and other kind of chains, that we transform them into the jewels that they actually are.
Very true. Dr. Pavankar, you want to add something here, please? You're on mute. You need to unmute, ma'am.
Sorry, I keep doing that. I really echo what Professor Nalapat said, and it's in fact, that was something I was trying to raise, that, for example, India is now like a really young population, very, very young population. 20 to 30 years from now, we'll see things change in India. And there are two things that one is India needs to be prepared for itself. That's number one. Secondly, firstly, of course, India can provide to the rest of the world. And secondly, India needs to prepare for itself. Because I have been here now 34 years in Japan, and I have seen what's happening. The aging population and the lack of people in work, this thing. So we will have to prepare a situation where there is a concept of health and prevention, that they don't have to face these chronic diseases as they grow older. So in imbibing that thing of nutrition, of the value of healthy food, healthy work, life balance, sleep is so important. Exercise is so important. If you look at the kids today, they're with the iPads and this thing, they don't go out and play. So all this thing has to be brought into the nuclear aspect of a family through a mother. So the education starts there and the health starts there. That's one. And the respect for the environment, these two things. The other thing is like when we talk about the aging population, the lack of this, we are already importing nurses from India and from other Vietnam and other countries because we have less people in that level of not so much in the level of doctors yet, but that is again a thing that's going to happen. So India should be prepared to provide to the rest of the world, as Dr. Chalil and everybody just mentioned. And secondly, India has to prepare for itself. And that's why I think one is technology and the other is affordability. And the third is trying to create awareness of the importance of what is health. And again, I repeat again, like a broken record, that when we talk about health, mental health is very, very important. People ignore the impact of mental health on physical health.
That's very true, and the brain drives the entire body. So
Absolutely.
that's very right. Mr. Nair, I want your opinion, in a way, like as a patient, if you would say, uh, 10 years before or 10 years today, how have the things changed when you go to a hospital or when you go to a doctor? If you can share that perspective as well, because that is also required.
First of all, I am not sick.
Always jovial and you have a great sense of humor.
This is child in me, so I enjoy. So I am not sick. But anyway, I really someday I'm sick also. But as I said, you go, the first thing they said, take an MRI. Yeah, MRI. And they see the MRI and they say, oh, it's all aging factor. There is nothing wrong. Then I am aging. And I also know I'm getting aged. But anyway, I'm a great believer of Ayurveda. In my own life, at the age of 8, I was to die. But I would not have been here. Okay? I was to die. Only Ayurveda helped me. When I was 8, when I say which year, then you will count my age. I don't want to say. But at that time, there was no medicine for tuberculosis. There was no medicine for typhoid. My mother died when I was 7 because of typhoid. And she could not get a medicine. We tried to get even from Mumbai. We couldn't get in Kerala. So there was no medicine, allopathy medicine, in those years. And my mother died at the age of 27. Her 27 years, right? Now, I had the same day or same week, serious jaundice. No medicine for jaundice. Even today, there is no medicine for jaundice. I'm telling you, I can prove it. And luck was there. I had to leave. And so somebody just passed. Thanks to yes, and thanks to army. One army man was just going through my house, and there were about 30, 40 people in our house. Who is going to die first, my mother or myself? That was the question. Both are ready to die. She from typhoid, I am from jaundice. All this, my nails, everything was yellow color, totally yellow. And this man was just passing, because the army man came on a leave, and applying, showing his body, applying oil and all. He was going to take his bath in a small river. He said, why this crowd? So they said, mother and son both are sick. People are waiting to see who is going to die first. So he said, what's the problem? He said, the one is suffering from this. So jaundice, there is medicine. You have a paddy field, the medicine is there. Why you can't pluck that and then give it to him? So nobody said anything. He came. He was going to the bath. He said, call my mother's sister. Said, go and pluck this. That is what I think Dr. Sharma said. And and I was given, but he told me that if you want to live, then the whole thing you have to take it inside and keep it for half an hour. We'll start omitting and all, but don't omit if you want to live. After this, I'll give you the whole, whatever you want, whatever food you want, I'll give you. Typical Kerala style, I want a lot of fry items, and that was all denied for 1 month. So he told my aunt, prepare the meal for him. After half an hour, if he is not bringing it out, prepare everything, and I would like to sit with him and eat. And he went for his bath. He came back after 45 minutes. The food was ready, and I ate, and I became all right, I'm alive. This happened to me.
Yes.
And another disease, no disease, I would say, another problem I have, no medicine those days in allopathy, and that was treated by only testing my nabi, the center portion of your body, which I don't think any allopathy doctor look at it. Huh? When I went for allopathy treatment, nothing happened. I couldn't go to school. I was in 10th class. So finally, this Vaidya we call Christian, he was a Christian, but following Ayurveda. As soon as I went to him, he did not look usually they look at this nadi, you know. He said, no, open your half pant and let me see your nabi. And he said, it's all heated up. You have inherent problem. And then my uncle told all the problem which I had when I was born. Okay, nobody knew that. He immediately gave me for 1 anna, that those days it was anna. I don't know what is the amount today, 1 anna. He said, go and buy this herbs and usko jo bhi karna hai, doodh ke saath. On the 5th day, I became all right. And no medicine in allopathy at that time again. So I'm a great believer of Ayurveda. Even today, I believe in Ayurveda. But I have a lot of doctors like Sharma, my friends. I have theology. I have all kinds of people. And one doctor Saab is oncologist sitting there. Dr. Jain is my dear friend. So all that is there. But I believe, in Ayurveda. 100% I believe in it. So it cured me.
Success story.
Yes, thank you. So the change, that is the change.
Actually, we need a holistic approach towards healthcare. This is what I feel. Everything goes side by side. It's a pleasure. Sorry.
I think one of the things I mean, Ayurveda has a very important place, and I think that's being now recognized even by the World Health Organization, and there are actually institutes being created. The most important thing also is that research, and I forgot to mention that not just for Ayurveda. I think we need to have more scientific research and science-based solutions to many of the things that we are talking about. And for that, we need to bring that into, it's not research and innovation only from drugs or devices or something, but also in the basic system of our education, which is what we have in US and we have in Japan. We have something like when medical doctors graduate, they also are trained to do their doctorates, which is partly clinical and partly research. And I think that is missing in India. And we really need to bring that into the curriculum, which will make people think. Because when I was a fellow, I was taught when a patient comes to you and you find 2 people who respond differently, you think why. That why should give the question for your basis of your research. And then you create the methodology and then you take it forward. And that's how many of the new therapies have come. That's how personalized medicine has come today. And Ayurveda, for that matter, in a way, is personalized medicine. So I think research is very important, be it in Ayurveda, or it should be there in our medical system, and scientific innovation will come from that kind of a system that's very much within our healthcare agenda. I'm sure that is part of what is also what the Science and Technology Ministry of India is now moving forward to.
Thank you so much. I can talk for hours in terms of health, but I think you have to make it interesting as well. So, closing statement for India beyond pandemic. One closing statement, Professor Nalpa.
I think the one closing statement is the opening of realization that India can do it. And I'd like to compliment my very esteemed friend, Dr. Chalil, whose belief in India is very strong, Ambassador Kapoor. And I think that belief is now there in a significant part of the population because of the fact that we faced COVID, and we faced it in a way which many countries could not, who are much better endowed than us. So, if I may say so, it's not a closing, but it's an opening for the future, or for the future of India as a healthcare provider for the whole world. Thank you.
Thank you so much. Ambassador Kapoor, one opening statement.
Well, my opening statement would be that this is an inflection point in the transformational journey for the world. To understand the relevance of India on the global stage in the Global Committee of Nations. And the time has come for India to be welcomed into the UN Security Council as a country, which is strategically very important for the world, which is very important for the world in terms of having the largest population and one of the youngest populations, as a country which is a driver of the global economy today, more than any other country in the world, as a country which is contributing in so many ways to digitization. And I am associated with some fintech work also, and I see the impact of Indian fintech on the global stage. So from all these perspectives, the time has come for the world to become a little more accepting. Today in India, we have hardly any headquarters of any global organizations. For the first 77 odd decades of our existence after independence, not a single global headquarters was established in India for any global agency. The first headquarters which was established in India was the International Solar Alliance, which was partly due to India, mainly due to India's efforts, not partly. The second headquarters which has been established, the Global Biofuels Alliance, again driven by India's initiative. Yoga is accepted as the International Day of Yoga all over the world. The world is very grudging in its respect for India and its appreciation for India and its understanding of India. The time has now come for a change in that attitude and for understanding what India brings to the world, so that not only the world benefits from it, but also the Indians can contribute even more to the world. I see Indians as leaders. The Vice President of US, she is of Indian origin. The Prime Minister of UK is of Indian origin. The Prime Minister of Ireland, Portugal, the Prime Ministers or Presidents of so many countries in the Caribbean. So we have great leadership potential. That is apparent. Nobody denies that. The CEOs of some of the biggest American multinationals are of Indian origin. In the C-suite of US corporations, more than 300 of the Fortune 500 have some top Indian in the top 3 or 4 executives of every organization. The Silicon Valley, more than 30% of the startups in the Silicon Valley are from Indians, IIT engineers and others. I can go on and on. The unicorns in the world, the maximum unicorns in the world are being created by Indians. So there is no limit to the potential of India. There is no limit to what India can contribute to the world. It is now for the world to realize that and open up the doors and their hearts and their minds to this reality. Thank you, Supreet, for asking that question.
Great answer, sir. Dr. Pawan, please. An opening statement, India beyond the pandemic. So,
You ask me?
yes, yes.
Well, I would just try to say that, India is in a very, very, living abroad. I mean, just like Ambassador and Dr. Joe, I live in the other far east of this thing. And I would say that the influx of India and awareness of India was much more in the US for many years. But in Japan, we didn't really have that kind of interaction with India, but I think in Japan is now partnering mostly with India, and the collaboration between India and Japan is so strong. literally every day we have some kind of initiative with India, whether it is Business India or Startups India, or it is Skill India. So we're importing skill also from India. We are having schools, Indian schools, Japanese students going to Indian schools. So basically, I'm saying people, even in the Far East, that were less aware of India are now looking towards India as a country with so much of resource, so much of intellect. And so I think the place for India to move out and provide everything is very strong. We are positioned in a very, very strong way. We are positioned in a very respectable way. We are admired by the world. And so it's time for us to act. How we do it is like we have to just make everything sustainable, and we have just to make things as easy to access, whether it's through digitalization or through partnerships with global organizations. Thank you.
Thank you so much. General Sharma, please.
My message is, or my concluding remarks is, we keep doing what we are doing and do not allow hubris to affect our performance. Nor should we start celebrating in advance that India is going to be at the high table. That brings in complacency, and complacency is not good. So I said, we do what we need to do, and the world will see the results of our efforts.
Thanks. Thank you so much. Dr. Chaudhary, if you can summarize.
No, I just wanted to say, thank you all for being in. But regarding the book, let this be, I think this panel discussion is a very good starting point. Let this be a discussion starter, this book. Let this start conversations. This shouldn't be a pathway to future, but this shouldn't be a pathway to a discussion to a future. I know we have smart minds here, a lot of IFS officers, a lot of IAS officers, a lot of civil service, army generals, AFMC graduates, whether it's Dr. Ruby or General Sharma, these are the smartest minds in the world. These guys can figure out, what can you do for the world. We just need to come together and to think wider, think broader, and for a healthier world, a healthier India first, and a healthier world in the future.
Thank you for giving me this opportunity to moderate such amazing people with great thoughts, and I learned so much from this amazing conversation. And over to you. Thank you.